Okay. Hi, everyone. Good evening. Thank you so much for joining us on this Monday evening for tonight's webinar. My name is Michelle Richard, and I'm here on behalf of Scleroderma Atlantic, and I will be moderating tonight's session. Tonight's webinar is on Nourishing Diets, Gut Health, and it's a continuation of our webinar series. We have Vanessa Cook joining us again, and she'll be presenting. But we do have a number of slides that we'll go through just to at the beginning. It's Scleroderma Atlantic's disclaimer. Scleroderma Atlantic is in no way endorses any drugs or treatments shared within the webinar. It is recommended that all drugs and treatments be discussed with your physician for proper evaluation and treatments. Also, for folks that are joining us on their computer, their laptop, you can ask questions at the end of the webinar, and you'll find the icon on the bottom of your screen that's displayed as well on the slide that Mary Ellen has put up. And if you are joining us via tablet, your iPad, you will find that icon to the top right of your iPad. So if there are questions towards the end of the webinar that you have, please enter them into that function, and we will address them at the end of the webinar. And so, like I said, we're happy to have Vanessa Cook back to join us. And for those perhaps that are joining us that have not heard Vanessa's bio, I am going to read it again. So Vanessa is a naturopathic student based in Toronto, and she's completed her psychology degrees at Western University. Her personal journey as a scleroderma patient is the driving force behind her passion for holistic healthcare, along with her role as the chair of patient support on the board of directors for Scleroderma Canada. Vanessa works in research with the Scleroderma Patient-Centered Intervention Network, or known to a lot of us as SPIN, focusing on projects aimed at enhancing the lives of scleroderma patients. She is dedicated to continuing patient-centered work, particularly in autoimmunity and women's health. Vanessa's holistic approach to healthcare reflects her commitment to making a lasting impact on individuals dealing with scleroderma by integrating personal experience, academic knowledge, and research expertise. And we are delighted to have you back with us, Vanessa. And Vanessa, we said the webinar for tonight is on gut health. It's all the rage, the buzzword of gut health, and we're constantly hearing about that. So looking forward to what you share tonight. But what does the research actually say about this topic, and especially in the context of scleroderma? So we're really looking forward to you sharing that information with us, and we'll have some practical evidence-based takeaways at the end of this webinar. So without me continuing to ramble on, I'm going to just turn it right over to you, Vanessa, and thank you again so much for joining us and presenting tonight.
Awesome. Thank you for the introduction, Michelle. It's always great to be here. I'm going to take a moment and share my slides. Take a second and see if this works out. Can everyone see that okay? I think, Michelle, I can probably hear you best.
Yeah.
Yeah, okay, beautiful. Let's get going. All right, so yes, today is on gut health, like Michelle had mentioned. So gut health is a massive buzz term, and I see it thrown around a lot in social media. And I think we as people living with scleroderma are the ones that are especially implicated by a lot of this information and misinformation that's thrown out there. So this was something that I'm really looking forward into breaking down and kind of going over what is gut health and what encases that for people living with scleroderma. So scleroderma is a complex systemic disease that we know. It affects multiple organs, but one of the most overlooked and most impactful areas is the gut. We know that gastrointestinal symptoms are in up to 90% of cases of people with scleroderma. And this can lead to bloating, reflux, malabsorption, and motility issues. So the gut is much more than just digestion. We are deeply connected to the immune system with the gut, inflammation, and even mental health. And those are some topics that we're going to be talking about today. The food we eat, the bacteria in our gut, and the way our body processes these nutrients can influence disease progression, symptom management, and overall well-being. So it's definitely a really important thing. I think oftentimes we hear that the gut is the second brain. That's a really big one that I personally believe in as well. So I'm excited to get started. For disclosures, as always, I am a member of SPIN. I do research with the Lady Davis Institute of Medical Research. I am on the board for Scleroderma Canada. I attend University College at the Canadian College of Naturopathic Medicine. And then obviously this is brought to you by Scleroderma Atlantic. And thank you so much for always having me. As a disclaimer, this is not medical advice. This is very much intended for self-educational purposes. The information shared is not a substitute for professional medical guidance, diagnosis, or treatment. So always consult your doctor and chat with them if anything in this webinar may have sparked ideas for treatment or symptom options and whatnot. Always have a chat with your doctor before using any of this information or education that we talk about today. So hello again. Michelle did a fantastic job introducing me. First and foremost, I am a scleroderma patient, but I am also a board member, a researcher, and a third-year naturopathic medical student. And I've used naturopathic medicine to kind of keep my symptoms at bay, and it's empowered me to want to share a lot of the education that I've learned in my degree to help others, especially in something like scleroderma, where there's very little patient resources and education out there since we are a rare disease. So thanks for having me. As always, we have our webinar breakdown. This month was gut health and scleroderma. For our upcoming one, it will be pain and fatigue. In April, we'll be talking about hormonal health and scleroderma. And then in May, we're kind of coming full circle, talking about long-term strategies and sustainable habits with all of the information that we learned. And then also the previous webinars are available on the Scleroderma Atlantic YouTube and are currently being uploaded as well. We aim, and I think we've pretty much done this every single month, where it's been the last Monday of every month, 6 p.m. EST and 7 p.m. AST. So gut health, why does it matter? The gut is a major part of the symptomatology and pathophysiological events that occur in scleroderma. So the gut has a lot of major implications with other body symptoms, such as brain health and the immune system that I also mentioned. Through supportive modifications, we can combat oxidative stress in the body, modulate immunity, and make the body a little bit more tolerant to adversities that we face with scleroderma and overall life. So understanding scleroderma and the GI tract, we often see that there is malnutrition, and I'm going to skim through this a little bit faster because I know we're all patients and we know what our symptoms are and what we go through, but just to kind of give a little bit more of a full picture without beating a dead horse. There's malnutrition, nutritional deficiencies. A lot of people experience GERD and SIBO, which is small bacterial overgrowth in the small intestine, pseudo-obstruction, reduced motility. I have Raynaud's in here because it can definitely be a barrier to eating different foods, colder foods, or potentially caffeine that might vasoconstrict in our hands and feet. Fatigue, as well as esophageal tightening and microstomia, which may limit us from eating certain foods and chewing the way that we will. So living with scleroderma obviously affects many areas of our health and well-being, meaning that treatment should have more of an integrative approach if we want to combat all of these things at once. So going into gut implications, this is also a slide from our last one as we're kind of building off of nutrition. So as mentioned, we have those physical challenges, contractions, Raynaud's, microstomia, which is the smaller mouth opening. Dry mouth can also be an issue, as well as dental concerns. So we have these physical challenges that may make it more difficult for us to actually consume food. In addition, once we get to the esophagus, then we have the tightening, acid reflux, stomach issues. You may have delayed gastric emptying or low stomach acid, bloating, stomach pain are all very common symptoms. Small intestine, we get to that small intestinal bacterial overgrowth. overgrowth that can occur in some patients, nutrient absorption, as well as reduced motility, so slower digestion, and that can also lead us to kind of that pain and bloating that we experience with scleroderma. Malabsorption in the large intestine can lead us to further inflammation, dysbiosis, where we have an unhealthy balance of bacteria. And then the consequences that we experience is having that weight loss, malnutrition, and deficiencies, in addition to also the symptoms, the bloating, the pain, not being able to eat, potentially choking when you go out. So these are all massive things. I feel like there's not one part of the GI tract that isn't impacted by scleroderma. So we know it's a really big thing, and kind of what information can we use to help us live and improve our quality of life. So key concepts, I want to go over immune function because it's a really big part of our gut. The gut-brain connection, this is actually one of my favorite topics to talk about. I think it's something I could talk about for like 100 years, especially being a psychology major. And then visceral hypersensitivity, and then a little talk about cravings. Key takeaways, we're going to talk about protein, complete versus incomplete protein, a note on different diets, so which diets should we maybe follow, interventions, and then different foods that we can implement today. We're going to talk a lot about fiber and different probiotic foods, etc., that we can look at integrating into our lives right away. So dysbiosis, I just want to give a little background and definition. This is just an imbalance in gut bacteria where harmful bacteria outweighs our good gut bacteria. We've got lots of bacteria colonizing our gut, and sometimes, especially in autoimmune diseases, we see a dysbiosis where that bad gut bacteria is now kind of overtaking things. So we see reduced motility, we have too much overgrowth of this bad gut bacteria. SIBO, which is that small intestinal bacterial overgrowth, can lead to bloating and diarrhea. Chronic inflammation, which most people do have with the disease, ultimately disrupts gut microbe balance regardless. And then heading into the gut and the immune system. So these are many different things that can impact our immune system. So the gut and immune system are deeply intertwined, and in scleroderma, the connection plays a critical role in disease progression, inflammation, and symptom severity. So there are many things kind of outside of our control and inside of our control that do play a role in how our gut microbiome was initially colonized. So things like antibiotics, and this is obviously never a knock on antibiotics, they can be 100% super necessary, but there's kind of been, I want to say within like the last 10 to 20 years, there's been a big push for stewardship with antibiotics. So doctors are prescribing them only when it's 100% necessary, so that we're not kind of wiping out all of the good gut bacteria as well. Certain medications can influence our gut microbiota, dietary factors, which we'll talk a lot about today. So potentially fillers, stabilizers, additives, processed foods all have a big impact. And on the upside as well, there can also be different dietary factors that are really great for our gut. Genetics play a massive role. Medical conditions, like we mentioned, scleroderma is one of them. Stress, birth delivery, this is a very interesting fact, at least to me, but people who are born via C-section versus vaginal birth have less colonization. And so we see that this exposure within the first 3 months of life is very, very beneficial. So that can go all the way to the person who first held you. You know, did you have pets in your home potentially? And when you were born via C-section, you're unfortunately not getting all of those microbes that you're exposed to when you have a vaginal birth. And this is not to say, you know, we can't go back in time and change things and maybe be breastfed versus bottle fed. There are all these things. So I also want to highlight that the gut is also a very resilient thing as well too. So even if potentially you're thinking, oh, well, I was born via C-section, or, you know, I know many people who were as well, it doesn't necessarily mean you're absolutely doomed. It just means that there are different ways that maybe we can help our gut in the future as well too. So going on to the gut and the immune system, This is going to be a little bit sciencey, so I'm going to try and break it down as best as possible. We see that 70 to 80% of the immune system is housed in something called gut-associated lymphoid tissue. So that stands for GALT. And the gut constantly interacts with the outside world through food, bacteria, toxins that we're all exposed to, and then immune responses and inflammation kind of interact in that way. So in scleroderma, gut dysbiosis and imbalanced gut bacteria that we talked about can contribute to chronic inflammation, autoimmunity, and then poor nutrient absorption. So leaky gut, this is also a term that I often see in social media. You may have heard of this before. The gut lining acts as a protective barrier, preventing toxins and undigested food from entering the bloodstream. With dysbiosis and inflammation, it can ultimately weaken this barrier, and that leads us to an increased intestinal permeability. So aka leaky gut, our gut is not holding itself together as well as we would like it to. And this allows for bacterial byproducts and toxins to ultimately enter our circulation and trigger an immune response and systemic inflammation. So for people with scleroderma, you may be having worse scleroderma symptoms if you suffer from something like leaky gut. Not to say every single person with scleroderma has leaky gut, but it is definitely a component that is often seen in people with scleroderma. And how can gut bacteria influence immunity? So we have things called short chain fatty acids, that's SCFA for short. And this is from fiber fermentation. We're going to talk a little bit about fiber towards the end of things. But when we have proper fiber, we're regulating inflammation and immune tolerance. Dysbiosis can also ultimately influence our immunity, and then pre and probiotics in our diet can help to restore this balance and support immune function. We're also going to talk a little bit later about the role of diet and gut immunity. So anti-inflammatory diets are always fantastic to help modulate the immune system. Cutting out high sugar, ultra processed foods may also help with decreasing dysbiosis and inflammation. And then we can also look at different nutrients. A lot of times, one of the ones I see in naturopathic medicine is when we utilize something called glutamine. This is something we see a lot in bone broth, and it helps to kind of keep those tight junctions in our gut nice and tight, so we're not leaking. It helps to kind of protect us. And that's something that I often see used when we want to support the gut as well as the immune system. So going on to the gut-brain axis, there is a bi-directional communication between the gut and the brain via something called the vagus nerve. Again, too, this may be something that you've heard on social media, but the gut and brain kind of connect to each other via this nerve and the gut microbiome. So the gut is often referred to as the second brain because of its influence on mood, cognition, and overall mental health. The connection is particularly relevant for people with scleroderma, while chronic inflammation and gut dysfunction are directly affected with mental health. I know that we often see, especially with the research that I've personally done, we see a lot of anxiety, depression, and low feelings in scleroderma. And I always think, if we can nourish our guts, then what impact will that have for our mental health? And is that something that we can kind of take care of and do ourselves and implement into our daily lives? So going off of the vagus nerve connects the gut via the brainstem, transmitting signals related to digestion, immune response, and mood regulation. Gut inflammation often is seen in scleroderma and can alter this vagus nerve activity, leading to increased stress and anxiety. So vagus nerve stimulation can ultimately promote calmness, reduce inflammation, and support gut healing. I'm not sure if anyone's ever heard of this tip before, but a lot of people will say you can hum and that will stimulate your vagus nerve, because the vagus nerve kind of, I believe it's interconnected with the throat. So if you hum, we're stimulating that nerve, and it can help to kind of relax things, both in a stressful way, but through our gut as well. As we mentioned, mental health and scleroderma, there's obviously chronic illness, including pain, fatigue, GI symptoms, leading to anxiety and stress. And if we can kind of use the gut-brain connection as a tool in our toolbox, then that can be something that can be really interesting. One thing that I love about this is that we've actually seen a lot of studies where they've used CBT and probiotics. So they use CBT actually to calm down the stomach, essentially. So I don't know if anyone's heard, there's an app called Nerva where they use CBT to target IBS symptoms. So by doing cognitive behavioral therapy, which is kind of like a type of cognitive therapy that we're learning different tools to calm ourselves down and deal with anxiety and face stressors in a more, I was going to say tangible way, but in a more problem solving way, then we can use this to calm down our gut. And then vice versa, we've seen probiotics and how that can stimulate cognition. So that's one of my favorite tidbits is, potentially looking at, okay, are there any CBT things, or can journaling potentially help in it, not only having an effect on your mental health, but having a massive effect also on our gut as well. So heading on, that was a lot too. I know we're going to have a question period after as well, if anyone has any additional questions. So heading into visceral hypersensitivity, stress is a major trigger for IBS symptoms, and IBS being irritable bowel. So we're having that bloating, distension, diarrhea, and pain, especially in conditions like scleroderma, where chronic pain and fatigue add to emotional stress. So stress can exacerbate gut dysfunction, impacting motility, increasing intestinal permeability, where we talked about with the leaky gut, and amplifying pain and inflammation. The gut-brain axis connects stress and increases gut sensitivity and altered digestive process. With dysmotility and bloating, we're seeing that this is a common complaint for people with scleroderma, and both stress and dysmotility contribute to uncomfortable sensations of fullness and abdominal discomfort. Mechanoreceptors are something that are located in our gut. I won't go too much into kind of the pathophysiology of this, but they are essentially sensitive nerve endings that are in the gut that detect stretch and pressure. So if we're having a bit of bloating, maybe gas or pain, these are going to detect that and essentially exacerbate these. They become very hypersensitive, especially in conditions like IBS. And we see that people have heightened sensitivity and heightened pain with normal gut movements. So for instance, maybe eating an apple wasn't uncomfortable for you before, but now we're eating an apple and we have that heightened mechanoreceptor activity. All of a sudden, eating that apple is going to become a lot more painful because we have gut movement going on and we have these overactive nerve endings in our gut. So scleroderma can exacerbate this activity due to fibrosis and changes in gut structure, leading to discomfort and pain with normal digestion and movements. So can we trust our cravings? This was actually something I was thinking about as I was going through making this slideshow, because I thought of a time that I worked at a gym and there was this one person who would always come in and he would tell me that, like, oh, I've been drinking so much juice lately. I've been drinking so much juice because I feel as though I've been listening to my body and that's what my body's been craving. And I think a lot about that as well, especially being someone in the holistic space, is, how much can we rely on our bodies and our minds to give us what we need? And anyways, all of that being said, the short answer to this is no. So food cravings are intense desires to specific foods, often high in sugar or fat. So these cravings are very much influenced by cognitive, emotional, behavioral, and physiological factors. So while cravings can guide us to consume energy-dense food, they are not always reliable indicators for nutritional needs and can often lead us to overeating as well as weight gain. So we see that they're very multidimensional, involving thoughts, emotion, physiological responses like salivation. But like I mentioned, they're often triggered by environmental cues as well as mood states, and particularly negative ones. So with that being said, one of the things that we look at in naturopathic medicine often is, are we having food cravings, and do we have sugar cravings? And generally, when we do have some kind of sugar craving, it may mean that we have dysbiosis or we're lacking something in our diet. So usually, if this was me and I was treating someone who had severe sugar cravings, we would look at amping up the protein, because that's going to help with satiety and making us feel full faster, but also including a lot of our dark leafy veg and greens, all of those things that we know are very good for us. So heading into the current dietary recommendations, this is also a slide from the last one. I just want to recap quickly. Our focus is always on fruits, dark leafy vegetables, lean proteins, healthy fats, cooked foods, and vegetables. The one specific diet that we always have the most amount of evidence for is the Mediterranean diet. And that's exactly what we mentioned. So we're having those lean proteins, a lot of fish, white meat. I think red meat is included about once a week if it is used at all. But that big emphasis on whole grains, whole foods as a priority. I can't emphasize that enough. And kind of using that also to amplify our diet as well. From before, we had talked about blood sugar balancing. You can see our previous slide deck where we had talked about blood sugar balancing and then identifying triggers as well. Specifically, we want to avoid processed foods, refined sugars, alcohol, excess caffeine, and then seed oils, things that are going to lead to inflammation in the body. Common sensitivities in scleroderma are FODMAPs, nightshade vegetables, caffeine, carbonation, and peppermint. And this is not to say that there are certain things that do work for people and don't work for people. If there are certain fruits that do not work for you, we want to avoid that. There are often a lot of individual sensitivities in scleroderma, and I don't want to take away from that either. So if our focus can be on kind of using anti-inflammatory ingredients like olive oil, and having lean proteins like eggs, fish, lean meats, and a whole lot of vegetables and fruit, then we're in a pretty good place. So heading into this, just a note on special diets. This was something that I wanted to chat about. With diet restriction, since we are living with a disease that is already kind of restricting us, so I always caution people with scleroderma, if they have the idea of, oh, I want to, maybe try out this one diet they saw online or whatnot. My only caution is, since we are already restricted so much by what we can and cannot eat, what we can and can't tolerate, if something's too cold or too hot or difficult to eat because of our hands, that's the only thing that I do caution. And it can kind of lead us to a place where we're already in a vulnerable position to be malnourished. So I always say try it with caution. If being vegan is something you've always wanted to do and it's something that really aligns with your ethos, 100% doing it, but just trying it with caution and being open to supplementing or finding ways to be creative to get different nutrients in that you may be losing out on. And that's just something that I think kind of goes without being said, but also with so much information online, it's hard to know where to navigate things. And I think a lot of times too, when you have a chronic illness, we are often, turning to, oh, well, I saw this one diet and maybe that'll work for me. And I saw this one, and 100% doing it if that's something that you're interested in. But just doing it very in an informed manner. Something that we discussed prior in a couple of different webinars as well was the notion of elimination diet. So this is when we are essentially eliminating one thing that we think could be triggering symptoms in us and eliminating it completely for about 1 to 2 weeks and then reintroducing it into our diet. This is something that can be really beneficial if you don't know if something is causing you discomfort or pain. A lot of times with nightshade vegetables, we'll try this out, different proteins, or if something's bothering you, it can be very simple just to say, let's not eat that one thing, but easier said than done. So this can be a good way that we can kind of actually test out if something is seriously bothering us or not. And then talking a bit about plant-based and animal-based proteins as well too. There's no right or wrong answer. Again, I know that can be a little bit discouraging when there's, you know, not a black or a white answer as to where we should go. I think it really is individual and depends how well people can digest things, and what works for you. Paying attention and having this kind of mindfulness around what you eat and how it impacts your body can be really beneficial. Keeping a diet diary is something I always recommend to people, because then we can actually see, you know, was it something I ate 2 days ago that was bothering me? Was it something I ate yesterday that really didn't agree with me? And then we can kind of go from there and retroactively look at things. So with that being said, to come to some things that we can actually integrate into, I'm just going to move this over here, into our lives currently, we're looking at different foods to avoid. And I hate to use the current term like gut unhealthy, but these would be gut unhealthy foods. We talked about these before, but the refined carbs, so we're looking at like pasta, white bread, etc., added sugars to things, trans fats, processed meats, so any meat that has been kind of altered in any sort of way or has different fillers or additives. I always recommend people to look at the ingredient label of the foods they're buying. Omega-6 fatty acids, which we discussed in our last webinar as well, but that's our canola oil, corn oil, palm oil, sunflower oil. These are things that we know 100% promote inflammation in the body and not good inflammation. Food additives, individual food sensitivities. There's a massive debate on artificial sugars. My current opinion on it is slightly undecided. However, we do see sometimes when we are ingesting artificial sugar, so this is something like your stevia, and adding it into our food, we do often see that we have like an insulin spike, even though we didn't take in any calories. So we're seeing that the body is still kind of like, oh, you know, I'm heightened, I'm ready to eat something, but then they didn't actually get that sugar component. So we have all this heightened insulin and glucose in our body, even though we didn't necessarily get the actual sugar itself. So there's a big debate on it. I think using it moderately, like any of these things, you know, if you have a Diet Coke from here and there, like maybe once a week or once a month, that's not going to kill you, but definitely just being mindful of it. I don't ever think it's a fix or a swap for real sugar. And yeah, just using that as something to kind of guide ourselves. High FODMAPs, which we had mentioned before, can be really beneficial to remove for people with scleroderma. Mind you, again, this is also extremely subjective. I know for myself, I can eat some high FODMAP foods, and there are others that just don't agree with me at all. But that's taken a bit of work to actually individualize what that means. I always caution as well with the discussion of gut health. We often get on the topic of cleanses and detoxes. From what I've learned, I don't think that there is much of a reason, very generally speaking, to ever wipe out our microbiome by any reading. And I think a lot of times when we see things that are targeted to be a cleanse or a detox, we often see them, you know, laced with different laxatives or things that stimulate digestion, and just stuff that isn't going to actually be beneficial for us, or in the term less beneficial than other things that we definitely could be implementing. And then also finding an appropriate protein powder. So I talked a lot about protein powder in our last webinar, but one thing we can do is look for something with a lot less ingredients in it. One of my favorites, or I guess two of my favorites, one is always a New Zealand whey. Whey can sometimes be a little bit difficult for people to digest. If you notice any bloating with whey protein powder, or you don't like whey protein powder, I do recommend anything that's a beef protein isolate. So instead of having something that's loaded with a bunch of stuff, it's kind of like having the whole steak. And I know that sounds a little bit gross, but that's basically what you're getting. You're basically just getting, you know, a chunk of the meat hydrolyzed, And that can be really absorbable for many people. Unflavored is always best. We're looking at something that doesn't have a lot of sugar in it. Usually if something has like a big obnoxious brand, shiny and scary in color, then I always say avoid that. But you know, looking for these certain brands that might be a bit more reputable, potentially third-party tested, is always fantastic too. Now going on to our gut healthy ingredients and things that we can implement: fermentable fibers such as oats, flaxseed, chia seeds, nuts, seeds, and dairy. Fermentable dairy, so our kefir, our yogurt. Resistant starches, actually one of my favorite things to talk about is how if you have a bowl of pasta or potato, and if you don't eat it right away, you let it sit for around like 12 to 24 hours, becomes this resistant starch. So what that means is that starch is now becoming harder to break down for our gut. And that may not sound like a good thing, but actually it's a very good thing. So it's harder for our body to break it down. It's going to be very slow going through our gut, and we're going to absorb it a lot slower. So we're not having a crazy glucose spike in our blood sugar. We're keeping things very at bay. So not to say that all pasta is healthy for you, but sometimes I like to use it to justify if I'm having a big bowl of pasta that, you know, if we let it sit overnight or in the fridge for 12 to 24 hours, it actually becomes this resistant starch, and is good for our gut. Also looking at fermented veggies, so our sauerkraut, kimchi, miso, and tempeh, and also apple cider vinegar. This again too is not something I would recommend doing without the supervision of a naturopath or your doctor. However, in some people who potentially have low stomach acid, taking a shot of that apple cider vinegar can help with digestion, and is also looked at with weight loss and weight gain and keeping insulin and glucose kind of more at bay. So that's kind of one of the ideas that I've seen used a lot in clinic as well too. With fermented vegetables and dairy, I do recommend people, they can get very expensive. However, these are things that we can actually make at home. So kefir and yogurt, I've made my own yogurt, I've made my own sauerkraut before, as well as kimchi, and they are super easy, super affordable to make. You know, look up a video on YouTube and do it yourself. And I think that's one of the ways that we can actually keep this. I will say for yogurt, all you need is, you know, like a scoop of your own yogurt that you would have, as long as it has like live bacterial cultures, and then whole milk, and you can make a massive pot of yogurt and keep it for yourself. And it's fantastic for your gut. So yeah, that's one of my little tidbits. For protein and probiotics versus prebiotics, for protein, we are looking at sources that contain all 9 essential amino acids. So when you're having anything that is animal-based or meat-based, it's going to contain all of those 9 essential amino acids regardless. If you're vegetarian or vegan, the big thing is just combining multiple different protein sources. So having multiple different legumes, maybe throwing in some quinoa, which it actually has 9 essential amino acids in it, but just making sure that there's a lot of variety in there if you do follow a vegan or vegetarian diet. I've been through all 3 diets in my lifetime. I've been vegan, vegetarian, and then back to eating meat. So I can definitely say a testament to all 3 that, you know, if you're eating meat, you're eating meat. If you're not, then just making sure you're covering your bases with that. With prebiotics, very simply, this is essentially food for our gut bacteria, and then probiotics are used to help colonization. I will say with probiotic supplementation, like a lot of nutraceuticals, we don't necessarily have the correct answer. We do see with people who are on long-term antibiotics or potentially went through a lot of stress, that probiotic supplementation is extremely beneficial for recultivating our guts. However, for people with, particularly with scleroderma, is it 100% necessary and helpful to supplement with a probiotic? We don't still 100% know. I will say usually with autoimmune diseases, sometimes in clinic we'll recommend a probiotic right away, or depending if they have used antibiotics in the past, or like I said, been through a really stressful period. This can be something that can be very useful, but this isn't going to be me telling everyone to go run out and buy a probiotic. I think there are a lot of ways that we can start implementing this into our diet, which is always safer and easier and more cost effective to do. And then under supervision with your doctor or naturopath, maybe discussing, is a probiotic beneficial for you? Going into fiber, so there are two different types of fiber. Soluble fiber dissolves in water and forms a more gel-like substance. The benefits of this is it helps you lower cholesterol, regulates our blood sugar levels, slows digestion, which can be helpful for people with diarrhea or loose stools if that happens to be a problem for you. It also acts as a prebiotic, feeding our healthy gut bacteria. And so sources of this are oats, chia seeds, flax seeds, psyllium husk. If you know what that is, it's kind of like a powder. It gets really gel-like. Lentils, apples, bananas, berries, and sweet potato. Insoluble fiber does not dissolve in water and adds bulk to our stool. So this helps promote regular bowel movements by speeding up digestion and preventing constipation. It acts like a brush, essentially cleaning the digestive tract and encouraging normal motility. Sources can be brown rice, whole wheats, broccoli, almonds, walnuts, and the fruits of skin. You'll see that there's often a lot of overlap when we're talking about soluble versus insoluble fiber. Oftentimes a lot of our vegetables and fruit are going to have both. Having a balance of both is generally most beneficial in the diet. I would say as long as you're paying attention to whole wheats, vegetables, and fruits, you're going to get your fiber levels covered. And just kind of being aware of how much fiber do you need for your particular body. And then, is constipation or diarrhea maybe an issue for you? Can we amp up either the soluble versus insoluble fiber? So sometimes with scleroderma, insoluble fiber can be a little bit irritating, and our soluble fiber is what's going to be easier to support digestion and help manage diarrhea or constipation. Like I mentioned, a balance of both of fiber and then tailoring this to your individual needs. So maybe let's say we amp up the foods that are heavier in our soluble fiber and we're noticing we're having a bit more symptoms, we'll want to find a balance between soluble and insoluble. And that's usually what is key, is finding a balance between the two. And then I want to end off on this quote that I really like by Michael Pollan. It's eat food, not too much, and mostly plants. And I always say, obviously, it's a lot more nuanced than that. But we see a lot of times that, people are promoting things that are gut healthy, things that are maybe not as beneficial for us as we would like them to be. And it comes down just to really simple principles. We're having plants, we're having things that are fermentable in our diet, and then also protein as well. And I think this kind of just summarizes, we're not complicating it too much. We want to have a lot of plants in our diet and things that are beneficial for our guts. And then going from there, I believe that's it. Yeah, okay, great. That leaves us with about 15 minutes for questions. I'm going to stop sharing my screen here.
Okay, yeah. Great. Okay, thanks, Vanessa. I was jotting notes frantically, and then I get overwhelmed. I was like, oh, where do I start? Where do I start? Oh, I like apples. So it's quite, I jot a little notes and then I get overwhelmed and then I stop and so forth. But lots of great information and lots of validation, I think, as well, or at least particularly for myself in terms of some of the things I'm trying or some of the things that don't necessarily work. And I like your advice and suggestions and reiterating how it's very much individual and a lot of things are just trial and error, and there's no right, wrong for individuals. Certainly, sugar is, not something that perhaps to take a lot, but, life with scleroderma can be tough sometimes. So it's like
Totally.
you have to, you have to have
Yeah,
those times where you can enjoy some of the sweets and various things,
for
but
sure.
all in
For sure.
moderation, as my mother would say. Moderation, moderation. So I want to you can see, I think, as well, Vanessa. Um,
Yes, yeah. So
okay,
non-dairy
so let's
yogurt.
yes, okay.
Yeah.
What are your thoughts on non-dairy yogurt? I cannot tolerate dairy at all.
So totally fine. Yeah, completely fine. And I think a lot of people with scleroderma that I've seen have a harder time tolerating dairy. They have like coconut yogurt. There's a couple of different brands that I really like. As long as we're looking for something that is low sugar, it's still fermented with those live bacteria cultures. You can usually check the label, or on the back it'll say like bacterial cultures. But completely totally fine. Yeah. Yeah, that's always
Yeah.
my first recommendation for people who can't tolerate dairy as well.
Yeah, and I know that I know too. I think I have some lactose intolerance, and I know that there is a yogurt as well that comes. I'm trying to think of the brand, but the brand of that. But there is a lactose yogurt that I have gotten, and I
Yeah,
seem to tolerate a bit better as well. But um, and do you have you said you make your own yogurt?
I do. I used to
Okay.
make it all the time, and it's so easy. Like you literally, you have to heat it to a point where it becomes sterile, and then you introduce the bacterial cultures from like the yogurt before, and then let it sit overnight, and you have like a massive pot of yogurt, and it lasts me
Okay.
forever. So yeah, I really highly recommend if you're ever bored one day and or need yogurt, I really
Yep.
highly recommend. Yeah,
Okay.
yeah.
All right. So Heidi has asked, you mentioned suggesting eating more protein to people
Yes.
who get sugar cravings, which is suggests that for all cravings, oh, I'm right there with you, Heidi,
Me
salt.
too. I was gonna say Heidi, me as well.
I know, high
um,
salt. Yeah.
so salt, I don't know. I do have a bit of a conflict with salt. I think if you are adding salt to your food, or having things that are a bit more savory, we're generally not hitting that overconsumption of salt in our diet when we're just adding it ourselves to our own food and cooking. Where we have an issue with salt is if we're, reaching for the chips or something that's really saturated in salt, and kind of those highly processed meals or microwavable meals or things that are going to be like absolutely just loaded with salt, even though you can't taste it. Usually with most cravings, we do try and push the protein for satiety. One of my recommendations is generally having protein earlier in the day. A lot of times I find we'll see people when they're not eating breakfast or they're eating a really late lunch, is when they'll kind of have that nighttime craving for a sweet or something because they didn't get enough protein in during the day. With that being said too, obviously like Michelle said, we all have to live. So, it's not, if you're pushing it, I often find for myself, if there's something that I've wanted for like a day or two, I'm gonna just have it. I'm gonna eat 400 carrots and still want a dessert. So it's finding a balance with it and just being notable, or maybe taking note of, oh, like I'm really craving a dessert, I'm gonna have the dessert, but then tomorrow I'm gonna wake up and have a really good breakfast or a really nurturing
Right.
breakfast, and kind of finding that balance between, it's not all or nothing, but it's yeah, it's something that we can kind of integrate. So definitely upping the protein, I think, is my biggest recommendation, but then paying attention to what did I eat earlier in the day. Is that kind of contributing to maybe now I'm hungry and want something that's less good for me?
Right, right. No, that makes sense. Okay. Let's see. Do we have any more questions? No, we have a quiet group tonight. Um, let's just double check. No, I I don't see any other questions,
Oh,
Vanessa. So like I said, we've got a bit of a quiet group tonight, which is fine,
that's
fine,
okay.
fine. Fine. Just again, just to let everyone know, we do all of our webinars are recorded and are posted on our YouTube channel. So you can find them there and go back and watch multiple times, or if there's sections, and that you particularly want to hear over and so forth, you can do that on our YouTube channel. I know you had shared the protein powder and bone broth last month, and we added that on to our email when it went out with the webinar as well, the webinar recording. So thank you for that. I don't know if there's anything else that you would like to add, Vanessa, around this particular topic.
Yeah, I think my biggest takeaway is that usually if you see people classifying stuff online as gut health as one or the other, it's usually not. And especially with scleroderma, I think we do have very much our hired nose. We know the things that are bad for us and we know the things that are good for us. And then kind of finding that in between in the gray area is very individualized, and listening to your body and doing research. And always you can reach out to me and send me an email if you're ever curious about anything as well too.
Yeah, and we have another question, and what we can do as well, Vanessa, is perhaps if it's okay with you to maybe even add your contact information, and then if people could have you as a resource. So I think there was another question. What about cooking with beef tallow?
So I'm not opposed to it. It's very similar to like a butter, where we're just using kind of like an animal fat. Technically is still like more inflammatory than like an olive oil, but if you like cooking with tallow, I sometimes use it on different vegetables and whatnot. I know we see it very much promoted as like a holistic superfood, etc. And will I say it's that? Maybe not 100%, but I don't think it's bad to use. If you like using it and using it in moderation, totally fine.
Yeah. And another question from Heidi. I've seen a lot online about the vagus nerve stimulation. Yes. Does this help with both the brain and the gut health? I can't tell if it's actually useful. I found it very interesting about the connection between brain and gut.
Yeah, so there's a lot of studies, and from what we look at as naturopaths as well too, is these studies that look at cognitive behavioral therapy. So those are those like therapy interventions used, and that's kind of targeting our vagus nerve. And then, like I said, using interventions like humming and meditation and these other things that also target our vagus nerve. So there's 100% like legitimacy to it, and it's something that's been really studied, and also like I want to say like a hot topic in research right now too, because they're finding that this gut brain connection is a really real thing, and how can we kind of honor that? I like looking up different ways we can stimulate the vagus nerve. Like I mentioned, humming is one of them, but also just doing more mindfulness activities is going to help with kind of going both ways, that bi-directional thing that we talked about. Yeah, okay. Thanks for asking. I know it's so fascinating. I always get really intrigued by that one.
Yeah, and humming, I mean, I tend to hum a lot, so who knew that humming would be not necessarily annoying to some, but serve as a benefit, right? I know Lisa just added a quick note saying for cooking French fries. So I'm taking that was the tallow. So
probably so.
Yeah. So Jeannie, for those of us who live with pulmonary hypertension and scleroderma, what suggestions do you have for reducing sodium in foods?
Okay, very fair. So that's kind of what I was getting at towards the end here, is generally when we are adding salt to our food, we're not really reaching that like crazy high sodium intake. It's really reducing the ultra processed food. So any microwavable or frozen food is going to be way higher in that sodium. If you're keeping it at home, sometimes being a little bit careful too, for anyone who takes electrolytes, just being like mindful, because sometimes those can be very heavy in our salt and beneficial for people if you're sweating or working out a lot. But if that's not you, just being beneficial of that as a product. That would probably be my biggest thing, is reducing the foods that you may potentially grab on the shelf. Taking a peek at also the nutritional information is always a really big thing as well too. Increasing water never hurts either as well for reducing sodium. But yeah, I would say the biggest thing is any of those kind of shelf stable foods like our chips or something that's in fridge section is going to be really high in sodium, and kind of avoiding those and having a shift to more whole foods and also unsalted foods. If you can bring it home and salt it yourself, or be mindful of the salt. Salt and sugar, it's very interesting how our palate kind of adapts as well too. So if you start adding less and less salt to your food, you're going to become more, what's the term, like more sensitive, I guess, to that change. And our palate is very adaptable to that. So, you know, if week one we want to decrease our salt, and we're going to say, okay, well, usually I add this much salt, I'm going to try and cut it by a quarter. That may taste like nothing. And I know I'm someone who like really likes salt in their food. But by the next week, you're already going to start to feel like, okay, yeah, this is a little bit salty, and have that taste mechanism there. So I always encourage people to try that, undersalting their food, and then adapt to it, and then keep going, and avoiding anything ultra processed as well.
Okay.
I hope that answered the question. Okay.
Thank you. Next question: is it safe to eat foods with collagen if you have
this
scleroderma?
Is such a good question. This is a great question. I think we were talking about it a little bit at the last one as well too, because I've been so interested in this recently. And I was talking with one of our clinic directors here as well, and I was mentioning about the collagen thing, because you would think, you know, we have an overproduction of collagen for scleroderma, but does it like translate in the way that, you know, we eat collagen, so then now we have more collagen in our body, and are we producing more collagen? Okay, I want to say in the research, very mixed, 100% mixed. It's not 100% known. We don't really know the mechanism. The one thing that we do have very good evidence for is skin hydration. So when we're taking a collagen supplement, or maybe adding it into our diet, we see that people have less dry skin. There's a bit of emerging evidence on joints. I see collagen a lot marketed towards joint health, and that's something that's kind of been researched, but not like super quality evidence. So I would say use with caution. Is it like my first line thing that I would recommend to someone with scleroderma? Probably not, just because of the uncertainty around it. With that being said, is it something that I occasionally take or add to my coffee sometimes when I need a bit more protein? And mind you, it's an incomplete protein, so you're not getting every single thing that you could possibly get from it. But yeah, that's something I occasionally add, and I don't think it's going to make or break anything. But I think just being cautious about it, using a good quality source if you do decide to use it as well too, and maybe see how your body reacts to it. But really good question. I've been like, I'm like, oh, should I take it? Should I not take it? And then, like I said, the answer is usually in the middle.
And you mentioned glutamine. It was glutamine. Glutamine. Now, is that something that normally you would take for a short period, like not something that would be an ongoing generally thing, or
I would say usually what I see is when we're trying to kind of build up someone's intestinal barrier, or for instance, if they have absorption issues, which people with scleroderma inevitably do, and maybe we're taking a different supplement that we really want to absorb in the body, then we're going to supplement with glutamine. With that being said, there's obviously different food sources. The first one I can always think of is bone broth, has a lot of glutamine in it. And that's not going to be unsafe to use, you know, potentially lifelong. Supplementing wise, usually we don't want to be on anything for like a crazy amount of time, but can be beneficial, especially if we're trying to kind of rebuild our gut, or maybe we had antibiotic use or went through stress, etc. Then that might be a good time to introduce it.
Okay, excellent.
Okay.
Again, we're coming up to our hour, so we don't have any other questions in the Q&A, and I think we've managed to answer those as they were brought up. So I think that kind of wraps up our time with you tonight. Just if you don't mind mentioning again, because I was trying to find my notes for March, but I think it was on managing pain and fatigue.
Yes, pain and fatigue is next.
So that's so that'll be for next month, next March. It'll be I think we're still on the same dates, same dates for February and March, but in terms of it being, nope,
Yeah,
it'll
I
be
think it was
31st.
still the, yeah.
The
Yeah.
31st.
Yay.
So we'll be back here next month, and look forward to everyone that is joining us tonight to join us hopefully again next month. And Vanessa, thank you very much for sharing your passion, your expertise, and knowledge around this particular topic. And to everyone that's joined us, have a great rest of your evening, and we'll see you next month.
Awesome. Take care, guys. Thanks
Okay.
for joining. See
Thank
you.
you.